Okay, so hi everybody, and welcome to this round of Take 20 with the Network on oral health and community engagement. So today we'll be hearing from Clarence Jones, Open's very own grassroots representative from Minnesota, as well as the executive director and community health strategist for the Hue-Man Partnership. Clarence will also be introducing you to some of his key partners that have supported this work along the way. But first, just a few housekeeping items. This presentation is being recorded and will later be posted on Open Communities, and that's at communities.openoralhealth.org. If you're not familiar with Open Communities, you can request a login and gain access to all open resources, policy alerts, and network-wide updates. I'll also drop that into the chat if you're unfamiliar. So I currently have most of you muted. I'll make sure that all folks are muted as we go forward. But at the end, we do encourage you to unmute yourself to ask a question, or you can type any questions you have into the chat box where we'll have time for Q&A at the end. And so with that, I will turn it over to Clarence.
Thank you, Francis. Good afternoon, everyone. First, let me thank CareQuest, the team, for inviting me to be a part of this event. I always appreciate the opportunity to share the work that we are doing here in Minnesota. Francis said this: I'm Clarence Jones, the Grassroots Representative for Minnesota and the Executive Director of the Hue-Man Partnership. And Hue-Man is a coalition of collaborators working on public health issues that have been identified by the community as important. So we work with HMOs, medical facilities, FQHCs, community organizations, individuals, researchers, academics, and governmental organizations. So we work with a lot of different kinds of people. We've been in existence for more than 20 years, but only as a Hue-Man since 2011. But in our existence, we have provided more than 250,000 health screenings to organizations and to community members with practitioners. We have also done 50 scientific papers with input from community members, and have been fortunate to be invited to other countries to work with their community health workers. In fact, one of my favorite trips was to Kenya, where I met some phenomenal dental community oral health workers. So this presentation is going to be like speed dating. I will have these opening comments. I'm going to introduce my colleagues for them to share what we are doing and have been doing about connecting here in oral health in this community. And then we're going to give you the chance to ask any questions that you want about our work. So my colleague for this quick presentation we're going to start with Dr. Deb Erdely. She's from Metro State University. And we're going to see a video where she's going to share the work that we're doing. And also want you to know that this particular project was part of the Minnesota 2035 plan, to give you an idea about how we're working in community and oral health. And then Peng Chow from UniCare, they provided us actually with a 37-foot medical mobile unit that we refitted and made it into a 37-foot dental unit that we refitted into a medical and dental unit. And we use that to provide healthcare and oral healthcare at community health events. And then Dr. Stephanie Booker from Health Partners, she will going to share information about an exciting project regarding pregnancy and oral health. We also have our Minnesota team here, Monisha Washington, Deb Jacoby, and Nancy Frank Wilson, who will either verify what I'm saying or vilify me. Just so you know, anything that we say, we want to be able to document. But with that, let's get started and find out what we're doing in Minnesota, how we're working together and bringing oral health to the community by working together. So with that, Francis, will you turn on the first video, please? Is it playing? We would invite them to come out to community health fairs where the nurses would have the opportunity to interface with the community. Can you try to the game, Francis? Hue-Man Partnership. There we go. Thanks. Hue-Man and Metro State met around 2013, 2014 with Dr. Deb Erdely. We decided that we would work together to acquaint student nurses with the community. And so the first couple of years, we would invite them to come out to community health fairs where the nurses would have the opportunity to interface with the community. Hue-Man Partnership is a collaboration and a coalition of organizations that work together to create good public health policies and practices and experiences. The Partners Prevention Clinic is a brainchild of Dr. Deb. We thought that we would get together at the Center for Changing Lives, and we would create a clinic that would allow us to, once again, in an inside environment, bring nursing students in, but also to be in a space, in a place where they can interact with the public and they can interact with people that would need help.
We knew in designing the clinic that we were going to focus solely on prevention. This is not a medical model design. This is a public health model of care, and it's public health nursing students that are offering the services, although it's very interprofessional because we have other community partners involved. So the services that we decided that we would be providing include blood pressure screening and education, pre-diabetes screening and education, and also we talk about good oral health because we know that good oral health correlates with good heart health. We also talk about stress reduction because we know where stress is a little lower, those cortisol levels, the stress hormone is a little lower, that people are going to be at less risk for heart disease. How we view the work that we do is, yes, it is a partnership, it's a collaboration. It's more than that though, it's advocacy. We believe in social justice, food security, housing security, healthcare security. We believe in the social determinants of health in that everybody has right to the basics in life.
We try to put them in a space where they feel safe and where they feel that they're with people that care about them and where their life make a difference.
I think my favorite part is connecting with people in the community, meeting partners. Oftentimes, like as students, we look at books. So we look at books or we're in a hospital. So here it's different. So that's what I like about this is I get to do health in a grander scale. So you're working in communities instead of individuals.
Meeting a range of different people and hearing their stories, their walks of life, and learning from them and getting a different perspective in life in general. So it's been very helpful.
The Partners in Prevention Clinic helps me become a better nurse because it's the boots on the ground, hands-on learning with people that may be underserved or misrepresented in the hospital system. And it's doing screenings and things that will help them avoid chronic illnesses and things like that. So it's really connecting with community members and getting a face to healthcare and maybe changing experiences they may have had in the past.
Well, my hope is that stakeholders will replicate the Partners in Prevention Clinic because it works. We know after doing this for a pilot period of 1 year that we are making a difference in the health of community members, reducing health disparities, building trust among populations that normally don't trust healthcare providers. And so we need to replicate this wherever we can, especially in neighborhoods where there is a level of poverty, where people have less access to healthcare, or they're less willing or interested in accessing healthcare.
Very, very, very memorable. I will never forget this day. I'm glad I came. I came here for one thing, and I got more than what I expected. much more than what I expected. I was coming here for the food shelf, and it was many things going on, and I had no idea I was gonna have an experience as wonderful as this one.
Thank you, Francis. Thank you. So now we're going to ask Dr. Deb to go first, and then Pang, and then Dr. Stephanie.
Thank you so much, everybody. And every time I watch that video, I get really choked up because it is a powerful experience and situation for both community members and our students. You know, the Partners in Prevention Clinic, as noted in the video, does focus on prevention services such as heart disease, dental disease, diabetes, and stress reduction. And the students are taught in the orientation, which is actually happening this Thursday, key areas, key items to focus on when it comes to oral health. The questions are embedded within an intake form that has been peer reviewed by advanced dental therapists. And the idea is, as Clarence early on steered us to talking with people, having conversations about their health concerns. And so some of the questions within the intake form that our community members fill out are as simple as, do you have any concerns about your teeth or gums? Do you have a dentist you usually see? When was the last time you saw your dentist? Would you like to see a dentist? And we work across populations. In the past year and a half, we've worked primarily with adults, but last semester we introduced some services for the pediatric population where the students were teaching parents lift the lip method. We also offered fluoride varnishing. And I have to tell you that all of these services were a smash hit. What's more profound to me, though, is the high number of individuals that came to the clinic with an urgent dental need who did not have a dentist. And so we collaborated with UCare as well as the Minnesota Oral Health Coalition to find resources to link individuals up to what they needed in near or real time. What a privilege it has been. And we have a lot of work to do. So I'll close.
Thank you, Payne.
Yeah. Well, hello, everyone. I'm so sorry. I logged in a little bit later because I was having technical difficulties. So I'm glad I was able to figure it out. But first of all, thank you for allowing me to be a part of this very important discussion around oral health. As Clarence mentioned, my name is Payne Chai, and I am the Community Relations Manager from UCare. As you all may know, UCare is a health plan, and our sole focus and mission is really to improve the health of our members through innovative services and partnerships across communities. Thus is the reason for the longtime partnership with Hue-Man. We've been very fortunate to work alongside them for maybe 10, 15 plus years because we really believe and support in the valuable work that Hue-Man does in addressing health disparities and also bringing health awareness into the communities, including oral health. UCare, we know how critical it is to the importance of oral health and how it is linked to the whole body. We try to educate and promote this when we are communicating with community members and then also just UCare members. And that is why we invest a great deal of our time and efforts around dental, not just for our members, but also for community members. So I wanted to sort of share with you some of the different services or initiatives that we do around dental. Specifically for UCare members, we do have a dedicated UCare dental connection line where our members can call us directly and we can help identify a dental home for them, schedule a dental appointment for them, and then at the same time, coordinate transportation or interpreter services. And then we also offer a dental incentive program where we entice sort of our members to go and get their oral checkup. And then in return, we give them an incentive for that.
Thanks, Payne.
I don't know if you guys are aware of this, but UCare has a mobile dental clinic. So it's basically a dentist office on wheels. So we were the first health plan in Minnesota to own and operate a mobile dental clinic. And it's still running. It travels throughout the state of Minnesota for UCare members who lack access to quality dental care. So that's still taking place today. And then for the community, we support community organizations like Hue-Man by offering free oral health supplies. We also identify opportunities where we are able to participate at community events. to provide education on oral health. And then we also, through our UCare Foundation, we also provide grants to support dental access. This
Hey.
year, yeah.
Hey, thank you. I love you, and I know you got a whole bunch to say.
done.
You got
Okay.
20 minutes. You
Okay,
got 20
done.
minutes.
Okay, I will put my information in the chat and everybody has.
Yes, that's
questions.
it. That's what I want you to do.
Thank you.
Okay, yes.
Thanks, Clarence.
We love each other, okay? Dr. Hooker?
Hi, everyone. I'm Stephanie Hooker. I am a health psychologist at Health Partners, and we are an integrated medical and dental health system as well as a health plan. And so we are in the early stages of developing a program to optimize oral health in pregnancy. And so you might be asking, why address oral health in pregnancy? So pregnancy is an important time to optimize the health of pregnant people and their babies through engagement in healthy behaviors. It's especially important to improve oral health because pregnant people are more susceptible to gum disease and cavities, in part due to hormonal changes during pregnancy. And pregnant people with poor oral health are at increased risk for adverse birth outcomes like preterm birth and low birth weight and preeclampsia. And so this is why we are trying to develop a program to help optimize oral health in pregnancy. And we're already keenly aware that this is a health disparity issue, that people who are from lower incomes, live in rural areas, or who are from racial or ethnic minority groups have poor oral health. And so the program we're developing is going to help use technology and behavior change strategies to help pregnant people identify areas to improve their oral health. And we're going to engage a group of community advisors to get feedback on that program and how we plan to implement it. So we can make sure it's a program that's going to be used by the people that we are developing it for, and that it's helpful for our participants. And we hope that this type of program could be integrated within prenatal education and part of our routine care.
Thank you, Dr. Stephanie. Francis, I'm gonna turn it back to you. Thank you all for listening to us. Thank you for my colleagues for being a part of this. And make sure that you all put your contact information in the mail, but I'm gonna turn it to Francis.
Yeah, thank you all so much. And so I will be copying all of this over and we'll be sharing this out back with all of you. But for the next few minutes, if you have any questions for Clarence and team, feel free to come off mute to ask, or if you wanted to type anything into the chat box as well, that works too.
Thank you, Francis. This is Beatrice Zimmerman from Virginia, and I'm the chair of the Virginia Coalition of Latino Organizations. I heard Ms. Chang speaking about interpretive services, and I would like to know a little bit more about that. How do they engage to provide those services to the community? I know that in some communities it is expensive, but I don't know how they may go about it. Thank you.
Yeah. So UCare has a contracted list of interpreter services provider that we work directly with. So if UCare members are calling and they need help scheduling transportation and interpreter services, we connect them directly with our contracted providers. So it's just a matter of getting contracted with UCare if they're interpreter agency, and then we go from there. Does that answer your question, Beatrice?
Well, yes, it does. But can you give us an idea? For instance, we service the Latino community that, as you know, are under, insured and all of that. So do you go about getting grants so that those services can be provided so that it could be an inclusive service provided to people?
Yeah, we do. Through our UCare Foundation, if they're not contracted UCare providers, we do provide funding to community organizations that offers their own interpreter services, whether it's for UCare members or for the public.
Thank you.
I want to thank you because one of my biggest concerns was making sure that I stayed within my 20 minutes. So, but you know what? If you have any other questions, I think that you can we put our information in the chat box. Please give us a call. We would be more than happy to talk with you. And I do appreciate once again, Francis and the CareQuest for the opportunity to be here. So I just want to be,
Yeah.
obedient and, you know what I mean? So thank you from my perspective.
Yeah, thank you all so much. And again, I will follow up with all of these links and email addresses so that you can continue the conversation. I've also dropped a brief evaluation survey in the chat box, if you don't mind completing that. And with that, thank you all so much, and stay tuned for the next Take 20 with the network. Have a great day, everybody.
Bye.